At PRM, we treat women with persistent pelvic pain and pelvic floor muscle dysfunction. The primary symptoms we see and treat are anything really pain or discomfort from the belly button to the mid-thigh, pain around or discomfort around intercourse, bladder issues, urgency, frequency, discomfort with urinating, and bowel issues with pain or constipation. This pelvic floor muscle dysfunction and persistent pelvic pain actually affects 14% of women throughout their lifetime. So it's quite common. And really the major kind of buckets that we see and treat would be anything under the gynecological realm, such as endometriosis would be the most common, as it's 1 in 10 women. We also see a lot of pain and discomfort around adenomyosis, fibroids, PCOS. So a multitude of gynecological issues can cause persistent pelvic pain. And then we also see postpartum women. So carrying and delivering a baby can quite often be difficult on your pelvic floor. So we see quite a bit of issues and symptoms around postpartum. And the last kind of bucket we would see would be perimenopausal, menopausal women with the hormonal changes. Can sometimes have issues with intercourse, bladder, bowel, and their pelvic floor.
So it sounds like it's quite common. Kind of a large number of women are needing your treatments. How are they ultimately finding you and accessing your services?
Yeah, Jason, that's a great question. So at this point, really, the data shows that our patients suffer for anywhere from 6 to 7 years on average with these symptoms, and see anywhere from 7 to 10 providers before finding us. So this is really what we're trying to improve, is educate both patient population and the healthcare system that there is treatment out there for these symptoms. So currently our patients are finding us through a combination of either direct referrals from their OBGYN, their urologist, their primary care doctor, or their pelvic floor physical therapist, as well as finding us either on the internet or through social media.
And once they find you, given that you're treating such a wide range of conditions, what are the types of treatments that you're able to offer to them?
So we are filling that gap in healthcare where we're that non-operative outpatient option for patients with persistent pelvic pain and pelvic floor muscle dysfunction. So conceptually, what we are experts at doing, number one is diagnosing, right? Because nerve and muscle dysfunction in the pelvis does not show up on imaging, classic imaging or tests, which is why it's quite often a delayed diagnosis. So we help kind of provide a proper diagnosis for our patients. And then our treatment protocol really embraces that multidisciplinary team approach, where at PRM, we see ourselves as the quarterback of our patients' care. So we are coordinating care. So between our providers, who are MD, DOs, or nurse practitioners, as well as with their pelvic floor physical therapist. And then also with our behavioral health program, which we have in-house through a telehealth platform, and our integrative nutrition health coaching program, which is also a telehealth platform. So we coordinate that care, as well as we have a unique outpatient protocol where it's ultrasound guided. And what we're doing is focusing on decreasing that inflammation in the pelvis that occurs around the nerves and decreasing that spastic muscles that occur in the pelvis when there's persistent pelvic pain. So we're reversing those and having patients decrease their pelvic pain symptoms.
That's great. Maybe spend a second on kind of the number of providers you have and what they're doing with respect to kind of providing services to your patients.
And we have a combination of MD, DOs, physiatrists, PM&R rehab doctors, as well as nurse practitioners, as well as we have 2 expert endometriosis gynecological excision surgeons who are highly trained in treating endometriosis, 1 in New York City and 1 in Dallas. For the gynecological care in the cities. And we also have a behavioral health specialist and a integrative nutrition health coach.
You talked a little bit about the telehealth services that you're offering. Can you expand on that a bit?
Sure, I would love to. So with the world of persistent pelvic pain and pelvic floor muscle dysfunction, it really is important to take a holistic approach to treating our patients. So we are offering both in the behavioral health realm, both group and individual sessions, treating really that upregulation of the nervous system that happens with persistent pelvic pain. Some really great courses, Thriving with Endometriosis, Retrain Your Pelvic Pain, Reigniting Intimacy. So the courses are really taking off and going very well. And then we also have our integrative nutrition health coach, who also offers both one-on-one health coach and integrative nutrition coaching, as well as group courses. Her group courses are targeted at our classic patient population, so endometriosis patients, as well as postpartum patients, as well as perimenopausal, menopausal patients. And lastly, we see quite a bit of bladder pain syndrome, interstitial cystitis. So she also has a course on that as well.
So given that you're kind of quarterbacking the process and working with a wide range of providers, both pre and after you seek treatment, how are you educating the market once you enter a new location?
Yeah, that's a great question. So a combination of things. One, our providers are excellent at getting out there and giving talks. So we're quite often giving grand rounds, whether it be to a local academic institution or a group of large pelvic floor physical therapists. So a lot of kind of grand rounds and speaking, educating the population that there is this treatment approach out there, as well as we have physician liaisons in every market that we're in. And their job is to raise awareness in the community about the disease process and educate them that PRM exists and that we can help their patients. So they're a lot of connecting with the referring providers in every community, our healthcare providers, to the urologists, OBGYNs, primary care, and pelvic floor physical therapists.
And as you think about kind of the treatments that you're able to offer, what are the outcomes research that you've been able to document? How have you documented that? And then what is ultimately kind of that documentation, those outcomes led to within your markets?
Yeah, I think great question. So we have been collecting outcomes nationally on all our patients, pre and post our treatment protocol, showing essentially that we are keeping patients out of the emergency room once they meet us. We're weaning them off their opioids, and we are ultimately decreasing the amount of procedures and surgeries that our patients need. So because, again, it's very difficult to diagnose because it wouldn't show up on a classic test, our patients quite often undergo unnecessary diagnostic and therapeutic procedures such as cystoscopies, endoscopies, colonoscopies, MRIs, etc. So we really want to make that shorter and decrease those unnecessary procedures. And in addition, we want to decrease the number of surgeries that our patients undergo in their lifetime, particularly for our endometriosis patients. So it really, we're trying to just decrease the number of surgeries. So that cost burden to the healthcare system, we're showing that we're really decreasing that and overall healthcare disutilization. In addition, we are showing that we are improving our patients' quality of life, decreasing their pain, improving their overall function. We're also showing that we're keeping our patients working, right? So we have absenteeism and presenteeism questions. So we're not only keeping them going to work, but we're keeping them high level functioning at work. So those are really the high level outcome measures that we are assessing. And lastly, we're really showing that we're improving their overall sexual function.
Well, thanks, Allyson. How have you actually developed your treatment protocols and kind of progressing your patients along this pain journey?
Yeah, thank you. So I actually had the issues myself postpartum, and pelvic pain can be a bit tricky where quite often pelvic floor physical therapy does help our patient population, but they plateau or it helps a little bit, but not getting them all the way. And the other options besides that out there or mostly surgical options or hormonal options, which can come with a lot of potential side effects. So that's where this protocol came from, really getting to the primary pain generators of pelvic pain, where nerve and muscle dysfunction, in a way where patients can be treated and go straight to work, go on with their day, no downtime. So that really is where it came from. There was just this need of an outpatient approach to our patient population.
And have you been able to kind of take that data to the payers, and then ultimately, what has the receptivity been around conversations with payers?
Yes, we have been active in speaking with the payers recently, showing them our outcome data, and really showing them that we are essentially saving the system money. And it's been going very well. We're really rapidly contracting nationally with the payers, which is very exciting, really ultimately improving access to care for our patient population, as well as saving the healthcare system money.
Yeah, anytime you're introducing a new service to the market, those payer conversations are important, and the fact that you're demonstrating success in contracting is kind of an evidence to kind of the outcomes that you're being able to provide. That's tremendous.
Thank you.
How has the business expanded over the years?
Yeah, we've expanded through organic de novo expansion, and we essentially are going to cities with our patient demographic. So our patient demographic is our females age anywhere 16 to 55, and also cities that have a high density of OBGYNs, urologists, sometimes pelvic floor physical therapists. But honestly, I mean, it's 14% of women in the US suffer at some point from pelvic floor dysfunction and persistent pelvic pain. So really the options are endless.
So a lot going on, obviously. Congratulations on all of your success. What's next for PRM?
Yeah, so what's next for PRM is, again, our ultimate goal really is to provide access to care for our patients. I mean, our patients have been underdiagnosed, undertreated, ignored, and suffering for just way too long. So that's really our underlying mission and goal. With that being said, we do want to continue to expand our footprint nationally, as well as to continue to develop our relationships with the payers nationally, and then continue to collect data on decreasing healthcare disutilization and the cost burden on our healthcare system of our patient population, as well as continue to really decrease our patients' pain and improve their quality of life, keep them working.